So there are exactly 100 new COVID-19 cases to report in the community today. Of these, 97 are in Auckland and 3 are in the Waikato. Takes our total in this outbreak to 3,733. In hospital today, we've got 58 people, all but one are in Auckland hospitals, and that other person is in Waikato Hospital. There are 3 people in ICU or a high dependency unit. Should say that among those people in hospital with a diagnosis of COVID-19, there is a number who are not there because COVID-19 is their primary diagnosis. So what we're going to start doing is tease out and report, in addition to the total number, those who are there because they require care for COVID-19. For example, we've had some pregnant women in hospital being assessed who happen to have COVID-19 as well, and other people who are being assessed for other problems who are also COVID-19 positive. Yesterday we had 28,521 tests processed around the country. This continues to be a high number, a really important part of our ongoing outbreak control in Auckland and our efforts to ensure that if there is any spread beyond Auckland, we detect it early. So thank you anyone who has come forward and been tested. Wherever you are in the country, if you have any COVID-19 symptoms, please do get a test. Up to Northland then, there are no new cases to report today, and there was widespread community testing and vaccination yesterday, and even more of that today. So as the Minister said, a high number of vaccines given yesterday and over 1,200 swabs taken as well. So there's additional testing and vaccination capacity up there today, including specifically at the Awanui Rugby Club, Taipa Eastern Rugby Club and Pukenui Wharf. That's today and tomorrow. And that's in addition to existing clinics at Kaitaia, Kerikeri or Haiwai and Rawene. There are also pop-up clinics and mobile units being directed to specific places over coming days, and mobile vaccination vans this week in Kaikoui, Kerikeri and again in Awanui. And of particular note, if you live in or around Taipa, Kaiongaroa, Awanui or Kaitaia and have had any COVID-19-like symptoms in the last couple of weeks, especially around Labour weekend, I do encourage you to get a test as soon as possible, even if you have no symptoms now. On to Waikato, the three cases there bringing the region's total number to 144. 2 of today's cases are in Hamilton and 1 in Otorohanga. 2 of them are already known to be contacts of existing cases, and the other one is being interviewed. All 18 of yesterday's cases have now been linked as well. There are new locations of interest that have been identified for Otorohanga and Hamilton, and so please do keep an eye on the Ministry website for any new locations of interest. We will make those public. No new cases to report in Christchurch today, and wastewater samples have been taken again throughout the city, and we're expecting results later today. On to Auckland finally, and there are 15 residents and 4 staff members now at the Edmonton Meadows Care home in Henderson who have now returned positive tests. 3 of the residents are receiving ward-level care at North Shore Hospital. Continuing the vaccination theme, I've got 2 areas to cover here. First of all, an update on the vaccines for 5 to 11-year-olds. We're expecting that application from Pfizer in the next couple of weeks, and MedSafe is ready to review the application promptly with a very careful assessment of the data on efficacy and on safety. If MedSafe provides provisional approval for use of the vaccine in 5 to 11-year-olds, we will, as is typical, seek further clinical and scientific advice from our CV Technical Advisory Group, and then it goes through to Cabinet for a decision to use. So far, it's just the US FDA that has authorised for emergency use the vaccine in 5 to 11-year-olds, and the US Centres for Disease Control is expected to make a recommendation. It hasn't yet on actual use. That's the equivalent of our CB tag. At this point, no other countries have approved Pfizer for 5 to 11-year-olds as of this week. And finally, just some clarity around the medical exemption process for vaccination. As part of the work on vaccine mandates and vaccine certificates, we are establishing a central process for approving medical exemptions. That will be used for people who are required to be vaccinated under the mandatory vaccination orders because they work in health or education or corrections settings. There will also be a similar related process available for people who need a COVID vaccination certificate to go about their daily business or participate in social events. That application process and the criteria under which people can apply will be on the Ministry of Health website, and we will publicise it early next week. It will incorporate both applications for medical exemptions as well as those, and this is for people who are required to be vaccinated under the order. They can apply for where there will be a service delivery disruption. And as I say, it will be a centralised process. Now, I understand that there are some people who have already been issued paperwork that is intended to be an exemption or an exception. If you have received such paperwork and work in corrections, education or health, you will still need to apply through a centralised process. If you have paid for that paperwork, you might want to ask for a refund. The new process doesn't apply to the people who have got exemptions under the existing border order, which are granted by the Minister. Those are separate and remain valid. So just to emphasise, this new central process, which has not yet opened, is the only valid process through which anyone can obtain an exemption, either because they are required to be vaccinated under the order or because they cannot be vaccinated for a medical reason and want that recorded in their COVID vaccination certificate when that becomes available. Thanks, Minister.
Today I'm very pleased to announce the government signed a purchase agreement for 4.7 million additional doses of the Pfizer-BioNTech vaccine. These doses complement our current portfolio and they're scheduled for delivery throughout the next year. This agreement will provide a continual supply of the Pfizer vaccine next year for those who didn't access the vaccine in 2021, but it also provides for us to extend eligibility to adolescents 5 to 11 years, and of course provides supplies for a booster program at such time as we determine that is necessary, and MedSafe grants approval for it. New Zealand's also committed to supporting ongoing immunisation efforts throughout the Pacific and Fiji. Should more population groups become eligible there, then we want to be able to support them with that. The Pfizer vaccination program is currently rolling out across New Zealand, and I want to encourage everybody to take up the opportunity to get theirs, particularly if they've not even had a first dose yet. If you do get your first dose now, you can be fully vaccinated in time for Christmas. We currently have around 2.8 million doses of the vaccine here in the country, and we're expecting an additional 1.5 million doses to arrive before the end of the year. We've also got the capacity available right now to deliver those vaccines as and where required, quickly, efficiently and safely. And that's showing in the progress that we're making towards our collective goal of getting 90% of people fully vaccinated as we transition to a new way of managing COVID-19 cases. To reach this 90% fully vaccinated target, the eligible people in each DHB area need to get to 90% first doses first. And it's good to see that 5 DHBs have already hit that milestone. Waitemata, 91%, Auckland on a great 94%, Capital and Coast 92%, Canterbury on 92% and Southern on 90% overall. Counties Manukau, Nelson Marlborough, Waikato, South Canterbury and Mid-Central DHBs are all getting quite close to that 90% goal. So it's a great step and a challenge to other DHBs. It shows that this is doable. Keep being creative and innovative and working with your communities to get them out and to get them vaccinated. And a reminder too for everyone, if you haven't had your second dose of the vaccine yet, you can book in today. There are booking spots available on Book My Vaccine. Across the country, 88% of people aged 12 and over have had at least one dose of the vaccine. 76% of people are fully vaccinated, that's eligible people, and we're edging close to 7 million doses delivered overall so far. Those aged over 65 are leading the charge, with 96% of them having been vaccinated with one dose and 92% now being fully vaccinated. We have had reports of people aggressively demanding from clinicians vaccination exemptions. No one is entitled to aggressively demand an exemption from the vaccination requirements. There is a process that we're putting in place. Everybody who needs an exemption will have to follow that same process. That process will be robust. And I also want to make it clear that anybody seeking to exert pressure in the way that we've seen, that is a matter that the police will be involved with if necessary and can follow up. The second point on that is if someone's offering to sell you an exemption or suggesting that you could pay a fee for the service of getting an exemption, they are trying to rip you off. There is no other language that I can use than that. There will be one exemption process and everybody will have to follow it. To a more positive note, it is going to be 3 weeks on Saturday since we had Super Saturday, and that means that the people who got their first doses on Super Saturday will be eligible. We'll be sending out reminder notices for those who got there to come forward and get their second doses from this weekend onwards. They'll get emails and text messages. There'll be some radio and social media promotions as well. We'll be advertising around this weekend's NPC rugby matches. If you're in Auckland, you'll be able to head along to Eden Park this weekend, not for sports, but to get your vaccine there. And that'll also, they'll have plenty of capacity there on site. A final note, Northland DHB, yesterday I talked about the importance of getting vaccination rates up there. 1,482 doses were delivered there yesterday. They've now had 80% first doses. Good to see that progress. Let's keep lifting those rates so that everybody is protected.